we say angioplasties and angiograms, well, who requires it the most and why is there such a stigma around it?
Yeah, I think people are still not educated in true sense.
Right.
Education means which helps to preserve yourself. Education is meant to preserve oneself. So that involves your physical health and making decisions in critical situations.
Right.
And able to make decisions on others' behalf when it is required.
Absolutely.
That's one front on health. In this country, we are not yet there.
Right.
In most of the country, there is a protocol. Patient has a heart problem, ambulance picks him up, comes to the emergency room, certain tests are done. If it's diagnosed to have a heart attack, there's a protocol that all of them will go into a certain procedure, whether it's an angiogram, angioplasty, or a bypass.
Right.
Because following that protocol saves maximum life and preserves maximum function of the heart so that person can be most active and discharged.
Very true.
Unfortunately, in this country, the uncle makes their decision, aunt or neighbor does a decision. Most people are not educated, and so sorry to say that most of them are economically not in a condition to make those decisions. They don't insure themselves. There's no proper coverage from the government side across the country. So it is out of pocket, which makes them very poor.
Right.
So that, financials also make them very tentative or insecure about undergoing the best treatment. If the money is taken out of the equation, the right way to treat any patient with a heart attack is when they come into the emergency, first thing we look at them is there a high probability of blockages in the heart, which has stopped or severely reduced the oxygen supply to the heart muscle. Then that patient, every minute his heart muscle is dying. The first 1 hour is called the golden hour.
Absolutely.
If you treat that patient and re-establish the blood flow within that one golden hour, he tends to preserve normal heart like he was born with. The longer he waits, some part of the muscle dies permanently and then he is left with whatever is remaining.
True.
So never delay identifying your symptom and reporting to the cath lab facility or an emergency room nearby. Because the longer you take, more heart muscles would have died.
Right.
And then coming to the question of what should be done, I think anybody who's having an ongoing heart attack, the best treatment, if it is providable, like in a city like Bangalore, would be an angioplasty.
Right.
Immediately take the patient to the cath lab, find out the block, get rid of the block. More than 95% of the times, the cardiologist will be competent enough to remove the block and re-establish the blood flow and preserve the heart function. If a person has a heart attack where there is no cath lab, then there are certain medicines which have to be given on an emergency basis to dissolve that clot and re-establish the flow. Although it is inferior to angioplasty, remember this, it is inferior to angioplasty because it can only dissolve in about 65% of the people.
True.
In many others, it may not be able to do.
And even the complications are higher.
Or more.
Right.
So, and when you give a medicine to dissolve the clot, you only dissolve the clot, but you don't do anything for the cholesterol blockage.
True.
But when you do an angioplasty, you clear not only the clot, also the cholesterol blockage. So future risk of heart attack becomes significantly lesser.
Absolutely.
So person should know that if there is an ongoing heart attack, his best chance of survival and better quality of life after the treatment is only if he gets the angioplasty.